Yeah, I've got time for maybe a couple more questions. Gentlemen, right here. Okay, folks back here.
Mr. President, my name is Lawrence McAndrews. I represent the National Association of Children's Hospitals. First, I'd like to thank you for your leadership with CHIP. Extending coverage to 4 million children is just fantastic. Second, as your leadership in CHIP has illustrated, perhaps children can lead the way. And I think we in the pediatric community, children represent 25% of the population, 10% of the healthcare costs. And we, I think, are a small enough community, cohesive enough, the doctors and the hospitals working together, we know each other, that perhaps we can offer an opportunity to be another leading edge in your plan for change. And we would work with you in the implementation of any quality measures, any new incentive structures. And I think children's hospitals can be a disruptor in the cost of care because they take care of 40 to 50% of the market, and we can, and the most expensive kids, working with you, we can make the biggest down payment. The Willie Sutton principle, so to speak, where the money is, we can help you manage that. Thank you very much.
That's a great point. That's a great point. I totally everybody right there. I'm going to take two more questions. This young lady right here, and then this gentleman right here. This is there a little bit early. Go ahead.
Thank you so very much, Mr. President. And it's quite an honor for you having all of us here today. You've created a network among us that we didn't even know existed. We are more alike than we are different. And I would ask that all of us help to make sure that the elimination of racial and ethnic health disparities be a core component of whatever healthcare reform legislation may look like that you enact. And I thank you again.
And that's an example of where, there is some data out there that's pretty indisputable. That even when you account for incomes and levels of insurance, that you're still seeing problems in the African American community, the Latino community, Native American communities in terms of quality of care and outcomes. And part of what we should be doing is to think about, based on this evidence and this data, are there ways that we can close those gaps? And to the extent that that is reflected in this reform, I think that will ultimately save everybody.
Thank you so much. Well, just one really quick. If you would give us the marching orders before we leave.
Mr. President, I'm Irwin Redlin, a pediatrician at Columbia University's Mailman School of Public Health and president of the Children's Health Fund. And I also just want to underscore how extraordinarily important this meeting was. It launches healthcare in a way that I don't think we've ever seen before in this country, and we all, I know, congratulate you deeply about that. And I wanted to say just a couple of words about prevention, which has been mentioned a few times. Prevention needs to be bolstered by a strong American public health system as well. And we cannot forget about the public health infrastructure as we're building and strengthening our healthcare system in general. So the public health schools are often the places where the research is done that tell us and guide us what kinds of preventive interventions actually work, and what works is really going to be important. I also wanted to underscore what Larry McAndrews said about the importance of investing in children. They are not only a compelling moral issue for us, but they are compelling fiscally as well. America is going to be depending on its children to be fully functional, to function in school, to succeed in ways that can only happen if their health is protected and guarded. And the final point is that I don't think we've mentioned yet the role of individual citizens. Every single American has a role to play in making us healthier as a nation. And your inspiration, hopefully the inspiration of others here, will make sure that individuals know that their choices of healthy lifestyle decisions and making sure they get the prevention that they need will bolster our ability to provide quality health care and reduce the cost of care that could have been avoided if we thought about prevention in the first place. Thank you.
Those are all great points. Let me just close by saying this, because somebody asked for marching orders. Number one, all of the groups here need to stay involved, and I know you will. Number two, we will generate a report or a summary of the comments in the various breakout sessions that will be distributed to all the participants. Number three, I know that Nancy Pelosi, Harry Reid, Mitch McConnell, John Boehner, and the other leadership are interested in moving a process forward. And so, unlike the Fiscal Responsibility Summit, where I think we have to have some discussion about mechanisms and how do we make it work so that it takes, I think here you've got a bunch of committees that are eager and ready and willing to get to work. And so I just want to make sure that I don't get in the way of all of you moving aggressively and rapidly. I've got some very strong ideas, and the White House will be providing some guideposts and guidelines about what we think we can afford to do, how we think it's best to do it, but we don't have a monopoly on good ideas. And to the extent that this work is being done effectively in these various committees, then I assure you that we are going to do everything that we can to work with all of you, Democrat and Republican. But the one thing that I've got to say, there's been some talk about the notion that maybe we're taking on too much. That we're in the midst of an economic crisis, and that the system is overloaded, and so we should put this off for another day. Well, let's just be clear. When times were good, we didn't get it done. When we had mild recessions, we didn't get it done. When we were in peacetime, we did not get it done. When we were at war, we did not get it done. There is always a reason not to do it. And it strikes me that now is exactly the time for us to deal with this problem. The American people are looking for solutions. Business is looking for solutions. And government, state, federal, and local, need solutions to this problem. So for all of you who've been elected to office, or those of you who are heading up major associations, I would just say, what better time than now? And what better cause for us to take up? Imagine the pride when we go back to our constituencies next year and say, you know what, we finally got something done on health. That's something that's worth fighting for.